Welcome back to Good Day State Line. So many of us suffer from headaches and we wonder if they're migraines or not. Tonight we have Dr. Merle Diamond, President and Medical Director of the Diamond Headache Clinic, and Jenn Tardy, Inclusive Recruiting Expert and Career Coach. Hi, ladies.
Hi.
Hello there.
Good to talk to you guys. I know we want to talk about the impact of migraines in the workplace. So let's start with what actually is a migraine, Dr. Diamond.
So migraine is a complex neurologic disease that impacts about 40 million Americans, and women preferentially over men, about 18% of women. And it presents with a severe throbbing headache associated with nausea, sometimes vomiting, light and noise sensitivity, and the biggest problem is the level of disability it causes.
So some of the symptoms then would be a headache, like you said, throbbing with the light sensitivity and sound sensitivity. How can we tell, though, if it's a headache or if it's a migraine?
Well, other types of headaches don't present with that typical type of pain, nor do they have the associated symptoms. So it's more than just the headache pain, it's the other pieces that come with it that add to the disability in migraine. And it's often misunderstood, which is why Jenn and I have partnered with AbbVie to look at migraine in the workplace and kind of see what patients' experiences are and what can be done.
Sure, because if you don't know if a migraine is coming and you're at work, that can't be good.
No.
So are there any preventative treatment options for migraines right now?
Yes, so there are preventive treatments which are supposed to reduce the frequency and the severity of the migraines, and Qulipta is a once-a-day pill that you take to prevent episodic migraine, which means less than 15 attacks per month. It's indicated in adults, and it can cause some nausea, sometimes constipation, and sometimes fatigue, but it definitely reduces the disability associated with migraine and also can reduce migraine frequency by over 50% in many of our patients.
So Jenn, I know that we want to talk to you about how many people are affected by these migraines and how a significant impact in the workplace on employees. Tell us a little bit about that.
Yeah, so migraines are the second leading cause of disability in the world. And so for those out there who may be thinking that in the workplace, I'm the only person experiencing this, just know that you're not experiencing it alone, which is one of the reasons why we're having this conversation today, because you're not experiencing it alone, and there are things that can be done about it. And so AbbVie sponsored a survey of 1,000 individuals in the US ages 18 plus who are experiencing migraines, and they wanted to learn more about the impacts in the workplace. And so some of the key findings that came out of the survey include 78% said that they're experiencing presenteeism, where they're present in the workplace, but the moment a migraine attack hits, then there is a decline in productivity. 74% even mentioned that it's just difficult to manage through their migraines in the workplace. But what stood out to me particularly was the 66% that said, hey, when I actually need to take some time away, it feels like when I ask for it, there's a stigma attached to it. And so those are some of the key findings that we found from the survey.
What advice do you have for our viewers who are suffering with migraines when it comes to talking to their boss about this, or what they should do or can do?
Yeah, so first it goes back to what I said before. Remember that you're not alone. And second, I encourage you to have a courageous conversation with your manager and share with your manager what benefits you most. What would you need in order to continue working and to manage through your migraine at the same time? And so some of the examples that came out of the survey results included maybe softer lighting, a designated quiet space, paid sick leave, or even time off. And then on the other end, I also want to make sure that I'm talking with employers as well too, just understanding how prevalent this is. Maybe not waiting until one person on your team comes to you to have that courageous conversation. Maybe proactively talking to your entire team or your entire department about the things that you have in place or what you're willing to do to support individuals who are experiencing migraine on the job. that's how you make it a migraine-friendly work environment.
Well, that is great advice. Dr. Diamond, before we go, where can we get some more information on everything?
You can go to Qulipta.com, which is Qulipta.com, or 1-855-Qulipta. And I encourage people who suffer from migraine to get help and to go to these sites to get more information.
Perfect. Well, thank you ladies so much for joining us.
Thank you for having us.
We'll be right back with more Good Day Stateline.